and she is qualified in MSc Yoga and Yoga Therapy from the Tamil Nadu Physical Education and Sports University, Chennai. Her areas of interest include cardiovascular physiology, conferences organized in physiology and yoga. She has also organized many workshops and national seminars in physiology and yoga at Jupiter. We are waiting, ma'am, for your great session, Yogic Approaches for the Mental Health. Welcome you, ma'am.
Good morning to you all. Basically, I am a physiologist and I will be talking about the mental health as well as I am qualified in yoga, and we are having a yoga center in Jipmer where we are catering to our patients. Not only patients, to Jipmer's family. I mean everybody, students, staff members and other things. With this brief understanding, I wish to go on to this thing. At the outset, I would like to thank the organizers for giving me an opportunity to be a part of this today's national conference. So my talk will be little different. So it is high time. Please pay attention. It is high time to prioritize mental health. That is what the theme we had in the last year 2024 mental health day also. So it is high. So why? For that is very important for the reason that is an integral part of overall well-being. So, and mental health. What is mental health? So, in scientific perspective, mental health encompasses our cognitive, emotional, and our behavioral, how you behave. And this mental disorders, so you know that is very important for whether you are as a person or as a health worker. Or as any gender person, you have to have a good mental health, because mental disorders contribute to significant load of morbidity and mental disorders patients nowadays, the research says they die. Mortality is also very high, very high compared to normal people, and lot of disabilities which affects their productions. So if you see the prevalence, actually phase 1 survey done by NIMANS and published in the year 2015-16 says that, see, phase 2 has yet to come, because I have not seen that report, found that 10.6% of adults in India suffer from mental disorders, and suicide is a significant risk associated with mental illness. And if you see the national data, that is on 2022, it says the highest suicide in the world is 12.54 per lakh in India. That's the highest, and most of these suicides are attributed to mental illness because of poor mental health. So it is high time, it is a need of the heart to prioritize mental health, to understand the mental illness and to give importance for it. So there are several ways of addressing this. So now coming to there are several factors which affects the mental health. Okay, it can be biological, social, cultural, financial, anything. But it is a complex interplay of this thing. I am not going into these. So you know there are n number of factors which contribute to mental health. Individuals will have individual factors will be there for having mental problems. But then these are considered as stressors. So the environmental stresses, the major, stress due to major life events, somebody lost, or some major trauma in the family, or it can be an abuse, bias, anything can be considered as a stressor. On the whole, if you say, this is considered as a stress to the brain, which is perceived as a perceived stress. But then, how a person reacts to this stress is different. It depends upon your genetic makeup as well as your personality. Somebody will take it light and come out of it. Somebody will be afflicted more severely, and that will affect their day-to-day life. But then, how these stresses, how the person takes will have an individual difference based on the genetic makeup, based on their personality. Then how the body reacts to it. Because I am a physiologist, I am interested to know the mechanisms, how the body reacts to this perceived stress. It can be anything. It can be a academic stress, or personal stress, anything, any stimulus which is putting a negative emotion, negative impact, then these are called as stresses. So how your brain reacts to it? The brain does what? It activates certain physiological mechanisms underlying to cope up with the stress. Coping strategies are activated. So once these coping strategies are activated, then there is a physiological response. That is allostasis. The term allostasis you would have heard. That is the physiological mechanisms are activated to maintain stability, to cope up with stress. But then that is adaptation to stress. How the body adapts to stress. But then once you get adapted, then if it comes to an end, it's fine. But if it is prolonged, then you face allostatic load. That is the wear and tear what you undergo in the period of stress. I mean, there is the failure of that thing that will cause disease. It can be a physical disease, physical illness, or a mental illness. Clear? Allostasis is the term we use for the whenever there is a stress, perceived stress, the body reacts to it by activating certain physiological mechanisms. Okay, like it will activate the stress hormones to come into act, so that you will be readily react to the situation, either flight or fight. Either you will run away from that, or flight. You need energy. So all these things will happen. But then, if it should come to an end, it should. If it is not coming, and if it is having it for a prolonged period, then it is called as allostatic load. That is the cumulative effect of stress on body. When there is a cumulative effect on stress, if it is there for a prolonged period, then it will manifest as illness. It can be a physical illness, it can be a mental illness. Anything, how the body reacts, it depends upon each individual. That is what, now since I am, so that is why mental health, maintaining mental health is very important. It is an integral component of health and well-being. So you need to maintain, otherwise you will be dizzy. So that is why, and your productivity and performance increase. So there is coping up with life challenges. So you need a good mental health. Then stress management, physical health benefits. Because I said disease can first affect the mind, and then it will incorporate into the brain, body, and then cause physical manifestation. Like all these things, stress can cause what? Non-communicable disorders, diabetes, hypertension, then sleep deprivation, immune compromise, all these things will happen, and then that will sometimes cause long-term, the mortality happens because of that. Then it build up and maintain a healthy relationship. Which one? Why to have a good mental health? These are the reasons one should have. Somehow you have to achieve a good mental health, because otherwise it will percolate into the body and cause physical illness too. Okay, then there is a quality. Ultimately, it contributes to a higher quality of life. So that is why I wanted to say, since I am going to speak on yoga, so the yoga has several centuries ago, yoga has identified the importance of mental health. You have understood. So yogic concept of disease is based on there is disruption in the mind-body. It is not body-mind. They have not said body-mind. They said mind-body imbalance, connection. If there is a loss, mind-body imbalance is lost, that is what they have put it as Adija Vyadi. What is Adija Vyadi? That is the central core is that mind significantly influence physical health. If your mind is very strong, your body can cope up. That is what is so. Mental health is very important, but people are not understanding, they are not addressing it. That is what I wanted. This has been addressed in yoga quite early. See, actually, the central core is mental disease. It is because of the Yadi, the physical disease, and the Adi is the mental disturbance. Mental disturbance percolate into the body causing the disease. So this is what. And according to the yogic concept, our body is comprises of 5 sheets. Okay, 5 sheets. That we call it as Annamaya Gosha, which is our physical body. The Pranamaya Gosha, that is the vital body, pranic body. The Manomaya Gosha, the mind and the thought. The Vijnanamaya Gosha, your intellect. And then your Anandamaya Gosha, which is your bliss body. Okay, understood? So the yoga gives, this has been identified very, very early period itself. We have 5 sheets. Don't ask me where is the mind, where is the body, where is the intellect. I cannot show. These are subtle things. Understood? So under these 5 sheets, your body is made up of 5 sheets. What yoga says is, your disease starts from mind. Then it percolates into the body, causing illness. It is not the other way around. We always think physical illness affects our mental. It is not so. Many a time, yoga has identified that it is always a mental. It starts from mental things. When you are strong, in your mental health is strong, then your ability to cope up with any stress, whether it is a body disease, traumatic stress or any disease stress, you will come out of it. That's why it is very clearly say that Adija Vyadi. That means the disease happens in the mind, then percolate in the body. That is what has been identified very primarily. Okay, madam, I will continue or... Okay then. Okay. Then see, that is why yoga is considered as a mind-body medicine. Mind-body medicine. So let us go on to, before this thing, let us have an understanding on this mind-body medicine. The word term yog means what? Union. It's a Sanskrit word meaning union. The union of what? The body, mind and the spirit. Don't ask me spirit. These are subtle things and it is all interconnected for a harmony, to have a harmonious life. Okay. And now next come is, there are so many schools of yoga which yoga to follow. That is another doubt everybody will have. There are several schools, Hatha Yoga, Bhakti Yoga, you would have heard. Jnana Yoga, Karma Yoga, Mantra Yoga, Tantra Yoga, which one to follow? But then, what I wanted to say is, the scientific data, we look into the scientific data. The scientific data is available only for Hatha Yoga and Raja Yoga. That's why we prescribe, we do it in our hospital, the Hatha Yoga, and we concentrate mainly on Hatha Yoga and Raja Yoga. What is Hatha Yoga? Hatha Yoga primarily means it improves the physical fitness and it is achieved by yoga asana practice. Okay, and purifying technique. By perfecting the body, the practitioner achieves better health. What is this purifying techniques? Are we going to, we are cleaning ourselves, but what is this purifying technique which yoga means? These are called as Shat Karmas. There are 6 purifying techniques that yoga states. These are called as Shat Karma. These are, you would have heard, Neti, nasal cleaning, Dauti, the cleaning of the digestive tract. Okay, Basti, the cleaning of the lower bowel, the large intestine. Then Nauli, strengthening of the abdominal muscles. That is to improve the efficiency of the abdominal viscera, organs. Then Stradaga, that is for a focused attention. You just keep on looking into this thing for improving your mental power. Then there is Kapalpati. Kapalpati is the forced breathing, fast breathing. Okay, force, that is also important for activating oneself. Okay, so to attain higher level of consciousness, or to put it as to attain, it is a stepwise fashion. Like you can't directly go into a state of happiness. People say that I am in a state of, but you cannot achieve that. We are not a saint. It takes long time. So it has clearly described. And Raja Yoga, Hatha Yoga is intended to lead Raja Yoga, and this Raja Yoga basically focuses on control of mind. Okay, and it has 8 steps known as Astanga Yoga. Astanga Yoga, which was put forth by Patanjali, the great Maharishi Patanjali. He has refined and gave a book called Yoga Sutra. He has refined, defined, redefined, and then put how for human personality development. How to go stepwise to have a good mental. Finally, this Astanga Yoga speaks about mental health. That is what I want to emphasize. Okay, you think, but it cannot be achieved by directly by meditation or this thing. You need to go in a stepwise fashion. That is, you have to go in a stepwise, a series of steps and reach that level. Okay, that is what in the Astanga Yoga says, and Maharishi Patanjali clearly states that, and there are 196 aphorisms in that. That is, these are concise statements like Tirukural. It has 2 lines, no, like that it has, and he has clearly, and it is if you read that, it will be really interesting. If people are interested, they can What is this Ashtanga Yoga? This Ashtanga Yoga was given by this thing. As I mentioned, it was a stepwise fashion. But then if you ask me, the research is there for everything. Scientific data is available for asana, pranayama, meditation. Rest of the thing, there is no much data available. You need to work on. Okay. But so what is this Ashtanga Yoga? If you see, it has 8 limbs. It has 8 forms. That is yama. These are social disciplines. What are social disciplines? When somebody has to follow. That is non-violence, non-stealing. Okay. These are some social disciplines one has to adopt. Truthfulness. These are then niyamas. These are self-discipline one has to follow. So that is why I told you it is a stepwise fashion to achieve a good mental health which is sustainable. Understood? So then another thing is niyama, that is self-discipline. What is self-discipline? First thing is you should be contentment. Okay. You should be content with what you have. Self-discipline. That is truthfulness. You should be cleanliness. They say cleanliness, contentment, self-study. That means you should have an introspection of yourself. Okay. Self-introspection. Then you have to have a surrenderness. Okay. These are. No study is available for this thing. But yoga clearly says this. Another thing is asanas. Yoga asanas. These are postures. Then the thing is postures basically benefit your physical body. Okay, the Annamaya Gosha. These are made up of food and other things. That's why it's called as Annamaya Gosha. Okay. So, Pratyahara, control of sense. Dharana, concentration. Dhyan, meditation. And Samadhi, state of blissful state. That is so that is what yoga, like people nowadays directly doing all these things, and it is not so. We advocate that you have to go first do purifying technique. Purify your body. Then the body will listen to your comments. Then slowly it will adapt to this thing. Then slowly in a stepwise fashion you have to follow. And you also have to follow self-discipline and social discipline. Okay. So these are the steps he has told for controlling your mind, for having a better mental health. Okay. So for this thing I thought I will just give a small demonstration. Let me see the timing. So, but this yogic practice shall be performed in a slowly. See, all these things they say how yogic practice has to be performed. But ideally, sunrise, sunset, all they say. But only thing is, all these things. One thing I wanted to do, yoga is different from exercise. By 2 important things. It is a slow type of exercise. That means you are not doing it anything fast. It is another, very importantly, you are doing with breath coordination. You are doing it with breath coordination. That you are walking. Are you aware of your breath? You don't concentrate on your breath and other things. So with breath coordination you are doing with concentration. That is how it is. And another thing is you have to practice according to your capacity. Okay, then see in our center, we have a yoga center as I mentioned. Then we'll do first initially we'll do loosening practices. Why loosening practices are given? To remove tiredness, to loosen the joint, to facilitate the joint movement, flexibility and improve circulation. Then we'll give Surya Namaskar practice. So all these things are important for achieving the physical health and slowly to the mental health. So that is it is a series of 12 postures which is performed dynamically with synchrony with breath. These are alternating backward, forward, bending type of asanas, which is so if somebody is not doing exercise also, if somebody learns about the Surya Namaskar practice alone, which gives a complete workout, that we teach for our thing in our yoga center for all our students, for all our this thing, how this yoga, that itself is per se is enough for giving a complete workout, okay, without any device, okay. Another thing is, so this is what it has, a number of benefits. It improves your flexibility, mental focus, circulation, your it puts pressure on your internal organs, efficiency of the internal organs, and it also corrects balance, flexibility, strength, everything you will achieve it by that. Okay. But you cannot, everybody cannot do this. That is very important. That's why we always say, don't go and learn yoga from anywhere. You have to go to a proper center, okay, with this thing, with a best yoga trainer. Otherwise, by seeing the media and other things, people does. But they also should know who should avoid yoga, because otherwise it will have a negative consequences. It will have this thing. Like those who are, we don't advocate yoga for these peoples. That is, those who have uncontrolled hypertension should not do the Surya Namaskar practice or other thing. Surya Namaskar practice, not for other thing, other limbs of Ashtanga Yoga. Then those who are in early pregnancy, we don't advocate. Even pregnancy and late pregnancy, we don't advocate. And then those who have a cervical spondylosis, degeneration of the spine, either in the cervical side or in the lumbar spine. Or those who have a hernia, that is the weak point from which the viscera propel out, no, the viscera is pushed out. It can be umbilical hernia, it can be femoral hernia, it can be any type of hernia. If there is history of hernia, it's better to avoid doing this thing. That's why you always have to go to your center and tell this thing, your illness, and then accordingly you have to do. And it is also still tailor-made. We don't give the same protocol for everybody. It will be given according. That's why we have a doctor, the medical professions to first to consult them, understand their medications, their illness, and then accordingly we advocate. Okay, that's what I do it in my center. Okay, so now coming to the asana. Asana is called as a pose, posture, or a position. It forms the base of almost all other practices. So it basically benefits the physical body. It improves your physical fitness, your stability, your flexibility, range of movement, strength, all these things. And it also gives a resilient mind. Okay. But these are just to classify based on how we can classify it. Based on the position we take, we can classify asanas. Or in general, based on the function. Based on the function, we classify asanas into three types: cultural asana, meditative asanas, and relaxative asanas. Okay. Cultural asanas revolve around. These are called as therapeutic asanas. That is, specifically, for example, if a diabetic patient, we give a set of asanas. That will, what it does is, it will improve the efficiency of pancreatic gland. Okay, like Bhujangasana, that is, like Bhujangasana, Dhanurasana. These are the things. So that is, here, these asanas revolve around the spine. They either bend forward or backward. When you do that, you put pressure on that viscera and improve its efficiency, improve its circulation, and all these things. So cultural asanas are known as the therapeutic asanas. Then there are certain asanas which we use it for meditation practice and for pranayama practice. And then relaxative asanas, when you are doing relaxation, when you have to relax, or in progressive muscle relaxation, deep relaxation test, we ask them to do it in two poses, one in prone and one in supine. Prone is called as Maharasana and Shavasana. Okay, these are the things. Then comes see what I told you, the scientific study is available for three important things. One is asanas. So remember in a very, in a one single line, if you have to remember, asanas improve your physical fitness. Coming to pranayama. What is pranayama? Pranayama forms the fourth limb of Ashtanga Yoga. And that the word pranayama is again pran and yama. Pran means the vital energy or life force. You have to imbibe the vital energy or life force. How to do that? So, if you ask me as a physiologist, I will just tell every tissue, every cell needs oxygen for its survival. So, for this, you have to just take that and improve that. That pranayama does that. Okay. So, pranayama, basically, it is how pranayama is different from breathing. We are all breathing. Is pranayama same as breathing? Yes. Can you just tell students? You are all breathing. Is it consciously happening or unconsciously happening? Consciously happening for you. It's not. It's happening just like you are not aware of your breathing. Okay. When you go into the next phase of dyspnea, maybe it is difficulty in breathing only. It's conscious thing. Otherwise, it's happening like. But pranayama is a conscious, focused breathing. You are doing it as a therapeutic intervention to improve your, one word, oxygenation. Tissue oxygenation will be improved. Okay, understood. So it is and the important part of pranayama is that if somebody wants to control the mind, the only way to control mind is pranayama. Do pranayama. So if time permits, I will teach you 2-3 pranayamas, which it will be easy for you people, and whenever you are stressed, it's 100% true. You go to any PubMed or any scientific literature websites, says the importance of pranayama. That is, and it is easy to do, easy to practice, but only